It's a problem that more than 2.5 million Americans face. We're talking about opioid addiction. Unfortunately, those numbers just keep growing.
In fact, the rate of people addicted to opioids has tripled over a 10-year period.
And that's why it's considered the nation's fastest growing drug problem. So here to tell us more about the disease's trends and new places of hope for addicts is Craig Stofko, who's the health officer with the Somerset County Health Department. Craig, thanks for joining us this
My
afternoon.
pleasure.
So we got stories all over the place about addiction and drug use. We even talk about it here. Is it really this critical a problem?
Much worse, actually. When you take the numbers, you're basing those numbers off of several data sources.
Yeah.
ER visits, arrests, self-reports. So the actual numbers are, I've read everywhere from double that to possibly 10 times, because the whole concept of mask addiction,
Right.
obviously those people aren't going to be self-reporting that they are in fact using. So those numbers might be alarming. The real numbers are much, much higher than that.
And you know, the face of these addicts, it might not be what we think.
It's not. If you could come into an addiction program and look at the people, some of those people look exactly like you would expect.
Right.
Most don't. Most look like us.
Yeah.
At least at the beginning. The mask, the 4.0 student, things like that, the athletes. It's anyone can be affected by this. Over time,
Right.
most people crash and burn because it's not something that can be sustained. So over time, people become more stereotypical appearance.
Do you think there's any one particular reason why people are getting addicted like this?
That's a question we talk about almost every day. What's behind this? A lot of different theories. Why are so many people self-medicating? How was it that so many people got hooked on pain medicine, and when pain medicine became unavailable due to things that happened in Annapolis, people realized that they can go to any number of dozens of places in the area and pick up $5, get you a bag of heroin.
That's unbelievable. And you can't really pinpoint the why, but you do have a campaign to help anyone and everyone. Tell us about that.
Well, Unmask Addiction is a statewide prevention, opioid prevention campaign. So we're trying to help everyone understand the depth of the problem, how it impacts all of us, and that there are things that we can do. And one of the most important messages I think for people to understand is there are treatment programs available. I don't really believe that most people understand how effective treatment is.
Right.
Treatment works if we can get individuals into these programs. Somerset County Health Department has a program that is consistently ranked the best in the state in terms of retention rate and successful completion rate. And we're talking about between 70 and 80% of the people that we see in our program successfully complete the program.
And you also have a tool that you're using to help people who may OD.
Well, Narcan. And we're giving Narcan training to anyone who wants it. The police, law enforcement has received the training, paramedics, but really anyone that knows someone or thinks they might have a situation where they come in contact with someone who overdoses. The Narcan can be administrated in several ways. We use the nasal inhalation.
This kills their high.
It brings them back to life.
Brings them back,
It immediately nullifies the effects of the drug so that they'll wake up.
Right.
Because basically what an opiate overdose does is slows the heart and the breathing to the point where a person dies.
It's close.
And even if you're not an addict, there's many things you can do to keep people from getting their hands on drugs, and take-back programs are very
A lot of
that.
people don't realize that it's a lot of the kids will see in their parents' or their grandparents' medicine cabinets prescriptions for Percocet or oxycodone or something like that. And a lot of the kids know what they are. They know that if they take a couple of these, they'll feel good. So, that's how some of them get started. Even the kids that aren't interested in taking it know that they can take one of these pills to school and sell it for $30.
So if
Get
you're
rid
not
of it
using
properly.
them, get rid of them.
we have
Thank
take
you.
back boxes at local law enforcement agencies, or you can call the health department. We'll direct you.
Thank
Greg
you so
Stofko,
much, Craig.
Somerset County. Thanks for coming
And if you
in.
Thank
missed
you.
any of the information on the new opioid misuse prevention program, or would like more information or addiction help, go to our website and click on our picture at the top of the page. Well, something else that can be incredibly addicting, tobacco. After the break, we learn about the latest Quit Smoking campaign and how creators say these new ads may capture smokers like never before. Plus, we're looking to capture some more bad guys or gals in this week's Most Wanted Monday. See if you recognize anyone this time.
And many criminals want in your home this time of year. Still ahead, you're going to hear some simple tips on how to protect your home from springtime break-ins. DelmarvaLife will be right back.